Maternal, Newborn, Child and Youth Network presents an educational video on the steps to take when faced with an imminent birth. In this video, we will demonstrate the actions healthcare providers can take to provide a safe delivery for both the birthing person and baby, and steps to take to mitigate risks such as newborn distress and postpartum hemorrhage. Let's meet Amanda and the midwives, Sarah and Danielle, who assist in this imminent birth.
Hi
there.
Hi.
Do you have your name and health card on you?
Yeah, I'm Amanda.
Hi, Amanda. Just sanitize your hands. We can do a COVID screen. What's the nature of your...
I think someone's coming.
One of the midwives. I'm Sarah. Can I help you?
Yeah.
Okay, why don't you come this way,
coming.
okay? How far along are you?
39 weeks.
Any complications in your pregnancy?
No, I think someone's coming.
Okay. Why don't we just try and get you up on the bed and have a quick listen to baby? Is that okay?
Yeah.
Common comments that patients might make include feeling like they need to poop, back pressure, rhythmic abdominal pain, and uncontrolled urge to push.
Right onto your side there. Beautiful. Oh, Amanda, you're doing so well. I'm just going to have a little listen to baby now, if that's okay.
Yeah.
With the Doppler.
Sure.
Great. And your water has broken?
I don't know. Maybe.
Yeah.
There was some stuff coming out, but I don't know.
Okay. And was it clear?
Yeah, I think so.
Beautiful. Baby sounds fantastic. Are you okay if we do a check and see what's going on?
Yeah, sure. Go ahead.
Hi.
Got a birth kit and some towels and a stethoscope.
Awesome. Amanda, this is Danielle. She's one of the other midwives. Danielle, this is Amanda.
Hi, Amanda. Nice to meet you.
She's due next week. She was up at the cottage, but she's not going to make it home before this little one arrives.
All right.
I'm just going to... Okay, I'm just going to grab those gloves.
Something's right there.
Beautiful. You can just raise your arm.
Keep breathing nice and slow.
Good deep breath.
That's
You're doing
the way.
awesome.
I'm just going to drop the oxytocin for the third stage.
According to the Society of Obstetricians and Gynecologists of Canada, active management of the third stage reduces the risk of postpartum hemorrhage and should be offered and recommended to all postpartum people. Oxytocin administered intramuscularly is the preferred medication and route for prevention of PPH in low-risk vaginal deliveries. Care providers should administer the medication after delivery of the anterior shoulder if time permits.
Amanda, you're doing wonderfully. Can I just help you raise your leg for a second?
Okay.
Great. And I can take another listen.
Perfect.
So much pressure.
Oh yeah, the head's right there.
Doing amazing.
Good job.
That's the way.
Nice deep breaths now. Amanda, I'm going to tell you to breathe just at certain points, just because we want your tissues to stretch really nicely. We'll just have the baby come down. This rocking motion's perfect. You're doing great. Beautiful, and baby's sounding wonderfully.
Is everything okay?
Yeah, everything's perfect. It's all happening just as it's supposed to.
It hurts so much.
Yeah, I know. Big deep breath.
It's burning.
Yep, nice pressure. Good, nice and slow. You're doing awesome.
You're doing exactly what you need to do.
Listen to your body. You can push as you need to. Guarding the perineum with slight counterpressure can be beneficial. Blanching may be noted on the perineum. When it is seen, encourage the birthing person to breathe or not push to allow for capillary refill, and which will improve the elasticity of the tissue and reduce the amount and significance of tearing. You're doing great, Amanda. Well done.
That's the way.
Take a big deep breath. You go ahead and listen to your body. If you want to grab behind your knee, some people find it very helpful to be able to direct their energy down that way.
Good job.
Well done. Oh, and here comes the head, so I want you just to breathe.
Good.
Just breathe. There we go.
Good
Eyes,
job.
nose. There you go. I'm just going to loop
Beautiful.
this cord right over baby's head.
Just gonna.
Everything is perfect.
Beautiful.
Good job. And we're just gonna wait for baby to restitute and face towards one of your thighs. Perfect. Now if you want to go ahead and give me another push.
Nice,
and
good
there
push.
you go.
That's the way.
It is very rare to need to clamp and cut the cord before the birth. Having the baby born through the cord, unlooping the cord, or somersaulting the baby are preferable. Clamping and cutting the cord is potentially harmful as it ceases the flow of oxygen to baby.
Down, down,
Down,
down.
push,
Good
there
energy.
you go.
Beautiful.
Excellent. Fantastic. Here we go.
Great.
Comes
Baby's coming up
baby.
onto your chest.
If the cord is tight and you cannot loop it around the neck, consider 1. Performing the somersault maneuver, or 2. Clamping and cutting on the perineum. The next video will demonstrate the somersault maneuver.
Excellent job, Amanda. So with the next contraction, you're going to feel a lot more pressure as the baby's coming down. Okay.
That's it. Good job.
So much burning.
Yes.
That's all really normal. It's just your baby coming
So
out.
well.
It's your tissue stretching.
Here comes the baby. Nice breathing.
Okay. Good
Just
job.
breathe. And there you go. Eyes,
Good.
nose. Beautiful. And there is a cord. Oh, it's quite tight. I can't pull it over, but that's okay. We're just going to somersault baby around. Okay. And
Good.
1, 2, 3. Give me
Almost
one more
there.
big push.
Biggest one you've got. That's it. Good.
There you go. Here comes baby. So I'm just going to keep baby's head nice and close to your thigh here so that I can get... There you go.
Beautiful.
And now I'm just going to unwrap this cord.
Baby's
Beautiful.
doing
There you
great.
go. Very good. Congratulations, Amanda. Well done.
Questions to ask once the baby is born. Is the baby term? Does the baby have tone? Is the baby crying? If yes, the baby can stay with the birthing person for routine care. If no, proceed to NRP steps.
Gonna put your baby skin to skin here.
Thank
she
you, guys.
looks great. Her pulse, I'm feeling it through her cord, is 130s.
She's okay?
Yeah, that first minute here, we're just gonna rub her down, do some skin to skin. It helps her transition. I'm gonna switch out the blanket here and give her a nice warm
Why is she not
blanket.
crying?
It's all right. That first minute, she's just taking a moment. So I'm just gonna rub her back and tap her feet. And that normally helps them to come around a little bit.
Okay.
See how she's nice and pink though? She's got good tone. She looks really healthy.
She looks great, Amanda.
This first minute always seems really long. She's doing great.
Okay.
Okay, I'm just going to position the baby's head just so we can let some of the secretions drain. Just kind of helps clear her lungs. She's doing great.
Okay.
Active management of the third stage reduces the risk of postpartum hemorrhage. It includes providing a dose of 10 international units of oxytocin IM shortly after the birth of the baby, controlled cord traction of the placenta, and assessment of the uterus to ensure that it is well contracted.
The next step is I'm going to give you a shot of oxytocin in the thigh, if that's all right. Essentially what that does is it helps to remind your uterus to keep contracting and helps reduce the likelihood of having a postpartum hemorrhage afterwards. Is that all right?
Yeah, we can do that.
Okay, perfect.
Don't you need to suction the baby? That's what they did last time.
Actually, we don't do that anymore because research has shown that babies transition really well when they're just on their mom's skin to skin like this. And so as long as she's right on your skin and not on your shirt and has a blanket covering both of you, then she'll transition well.
Okay.
Okay, Amanda, I'm starting to see a separation gush. So if you're okay, we're going to clamp and cut the cord and then deliver the placenta.
Okay.
Great.
So I'm just going to have Danielle make this a little bit easier for access. And are you good if I cut the cord?
Yeah.
Fantastic.
Beautiful.
So there's one clamp, there's the other clamp, and then I'm just going to grab the scissors. And there you go. You're on your own, little one.
Great.
And Amanda, if I can get you just to relax your leg open for me. I'm just going to have my hand here to guard your uterus, and then I'm going to do some gentle cord traction And here comes placenta. Excellent.
Beautiful.
Well done.
Is it out?
It's out.
It is.
Now I
Great.
just need to give you a pretty mean belly rub. Just to make sure your uterus is well contracted. Are you okay with that?
Yeah.
Nice, good deep breath in.
Breathe and push.
Ah.
And lots of
Ow.
pressure, a little bit of blood and a clot. So we're going to do it again.
Okay.
Okay.
Good deep
Take a
breath.
And this part's really uncomfortable. I'm sorry.
Almost
And
done.
There
You've
you
done great.
go.
Good job.
Great. Everything's lovely, and your blood loss is very normal at this point.
I can put your blanket back on to give you a little more comfort here.
And we'll just change the blue pads out underneath you. And then I want to take a look and make sure that you don't have any lacerations, okay? So I'm just gonna switch my gloves out and then have another peek.
Okay.
Okay, Amanda, I'm just going to do a set of vitals on you if that's okay. So I'll put on this blood pressure cuff.
That's great. Thank you both so much.
Oh, absolutely our pleasure. You did amazing.
Congratulations. I'm just gonna, when the blood pressure is done, I'm going to have a little look just to see if there's any tears. It's just gauze, but it does feel like sandpaper.
Good. Great, so your blood pressure looks wonderful, 115/75, and your pulse is excellent. So no concerns there. We'll just do that every 15 minutes or so in the next hour. And I'll also take a listen to baby as well for their vitals while Sarah takes a look at your tear.
Are you okay, Amanda, if I go ahead?
Yep.
Okay, you're gonna feel my touch now, just on the outside here. And I'm just gonna use the gauze to have a peek inside. Nothing at the top. On the sides or at the bottom. Fantastic, you're intact.
Wow.
Well done.
Good job, and baby sounds great.
We're gonna just check your belly a few more times over the next little while we're doing vital signs, just to make sure everything continues to be really good. Congratulations, Amanda, you did amazing.
Thank you guys so much.
Every person remembers the way they were made to feel on the day they gave birth. Consent is important, listening is important, trust what they are saying about themselves. Don't separate baby and birthing person. Skin to skin is the ideal way to have baby transition and have baby stay warm. The precipitous delivery can be very overwhelming. Talk to the birthing person and support people they have with them. Try to be calm throughout the process. Involve support people as appropriate. Ongoing assessment of vitals for both the birthing person, including bleeding amount, and infant, including looking at baby, reassures everyone that things are remaining normal. Postpartum hemorrhage reduction includes active management and breastfeeding initiation.